You know the story, right? Picture this. Saturday morning soccer tournament championship game. Your star striker, let's call her Alex, she drives toward the net, gets clipped, and just slides like 5 feet across that gravelly edge of the field. Ouch.
Yeah, I can practically feel that.
Right. She pops up, she's furious, but then she looks down at her knee, and it looks like, I don't know, someone took a cheese grater to it. And then, boom, immediate chaos. You got trainers sprinting, parents yelling, and you're just standing there thinking, ugh, do I just hose this down? What do I do? Those moments, you know, the ones that look kind of gnarly but happen all the time in sports, they feel totally out of control. But they don't have to be. Look, we're not trying to train you to be an orthopedic surgeon here.
Definitely not.
But we are trying to give you the essential info you need to handle that immediate crisis, whether it's a killer scrape or, you know, something way worse. Exactly. That's our mission today. We want to distill the most critical, the most immediate knowledge for basic wound care, for those field emergency procedures, straight from the sources. We're moving way beyond just, oh, put a Band-Aid on it.
Yeah, gotta do more than that.
We are basically setting up your field playbook. It's about bringing control to that chaotic moment. And that control, really, it comes down to 3 foundational things. Doesn't matter how big or small the injury is.
Yeah.
Cleanliness, making sure nothing harmful stays in there. Protection, keeping it covered and safe. And monitoring. You got to watch for signs it's getting worse, like infection.
Yeah.
Get those 3 right. You seriously cut down on complications and, you know, set things up for proper healing.
Okay, let's unpack this right now. Because before we even think about protection, bandages, whatever, we have to deal with the mess.
Always.
So what's the real difference between like a quick rinse and, you know, serious wound management? Because honestly, sometimes I see people literally rubbing dirt into the cut, trying to clean it with their jersey sleeve. Please tell me that's wrong. Oh, it's absolutely wrong.
Yeah.
And that difference, that distinction you're making between just basic cleaning and actual wound management, that's precisely where most people mess up. Cleaning is just, you know, the mechanical bit, getting the obvious dirt and stuff out.
Right.
But the real heavy lifting, that's debridement. It sounds technical, but it just means actually removing the dead, damaged, or possibly infected tissue.
Okay, hold on. Why is removing that tissue so vital? Isn't dead tissue just, well, dead? Why bother?
Well, because if that dead tissue stays put, it basically becomes a 5-star hotel for bacteria. It's the perfect breeding ground. So when we talk about reducing infection risk, helping things heal right, debridement is absolutely key.
Okay.
Now, let's be clear. We're not talking about the really intense stuff, surgical debridement and somatic stuff that's for the pros in a clinic or hospital.
Right.
But for basic field care or at home, debridement just means gently, purposefully removing any loose, obviously dead tissue you see while you're cleaning. Thing like loose flaps of skin on a bad scrape. That's super important for those bigger abrasions.
Got it. So cleaning's the wash cycle, debridement's like the targeted spot clean.
Hi, this is Dr. Donald Pelto. I'm going to show with this video how to debride a wound. You see around the wound there's this white callus tissue that comes all around it, and that's from the pressure buildup around the bottom of the wound. This is the red portion, the red beefy healthy portion. Every time a patient comes in, we actually have to trim off this callus tissue. This is what's important to get a wound to heal. You can't leave this portion on here. Now, this doesn't hurt the patient because this patient has neuropathy, but even if they didn't have neuropathy, this is just removing callus. It's not actual. Maybe this, as he's groaning up front, right? It's not hurting, but I guess it is. So sometimes it just hurts a little bit. But for the most part, it doesn't hurt that much. So you do the first time with that, and then let me grab something else over here. And then I'm going to grab a razor blade here, and then I want to get it down to about the same height as the skin around the area. See all this callus? And then the next key, after we remove this down, is we have to find the best way of offloading this foot. Now, just as an example, this is how it was, and he already had one surgery. And if you look over on this other foot right here, this foot recently healed from a wound that was open for a long time. He's had a couple of surgeries here. We had to take out a big portion of the bone here to get this healed, but finally it's healed. So we hope But this one, now we're going to work on this one to get it healed.
Okay, let's get practical. This is the 6-step quick clean rule for those scrapes or smaller cuts. This is like non-negotiable, people. So step 1, 2, 3. First, always wash your hands well. Put on gloves if you have them. You don't want your germs in their wound.
Absolutely crucial.
Then step 2, rinse the wound right away. Clean water, saline solution if you've got it. Step 3, clean around the wound first. Use mild soap, move away from the cut.
Yeah, don't wash towards it. And then come the really important middle steps, 4 and 5. Use sterile gauze, okay? And gently wipe the wound itself, always starting from the center and moving outward.
Pushing debris out, not dragging it in.
Exactly, you got it. And step 5, this is where people rush it, sometimes rinse it again thoroughly, get all that soap residue off. Soap left behind can really irritate the new tissue that's trying to heal.
Okay, good tip. And finally, step 6, pat it dry. Use clean or, ideally, sterile gauze. Don't rub, just pat. Prevents more damage.
Perfect.
So now it's clean, it's prepped.
Wound cleansing. The purpose of wound cleansing is to remove and loosen debris and contaminants from the wound bed. Method and cleaning solution will vary based on the type of wound. However, normal saline is most frequently used. Clean aseptic technique should be used unless otherwise indicated. For linear wound incisions, pour irrigation solution into irrigation tray. Moisten 4x4s in solution, squeeze out excess. Solution should be at room temperature. Gently wipe wound from top to bottom in one motion, starting directly over the wound. Discard the used 4x4. Using a new moistened 4x4, repeat cleaning with gentle downward stroke parallel to the incision. Repeat steps, working outward from the incision lines parallel to the incision. Remember to use a new 4x4 for each downward stroke. If needed, dry the wound, following the same procedure as for cleaning. Use dry gauze pads.
What about dressings? I feel like most people just grab the biggest Band-Aid they find and slap it on.
Yeah, and sometimes that works. But dressings do more than just cover. They protect, they absorb any drainage, and they actually help create the right environment for the tissue to regenerate.
Okay.
And the key thing is, for any open wound, that dressing must be sterile. You mentioned adhesive strips, gauze pads. Those are common. But maybe we should also quickly touch on hydrocolloid dressings.
Wait, what? Hydrocolloid? That sounds super fancy. What are those? When would you use them?
They sound high-tech, but they're actually pretty great. They're these absorbent dressings that form a sort of gel. The big advantage is they keep the wound environment moist, which is actually really good for healing.
Oh, interesting. Not dry.
Nope, moist healing is often better. They're fantastic for those shallower wounds, maybe with a bit of ooze, especially if you need something that can stay on for a few days. It acts almost like a second skin while things are healing underneath. It's definitely a step up from standard gauze sometimes, which can dry things out and need changing way more often.
Good to know. Okay, so we've cleaned it. We've maybe picked out our fancy hydrocolloid dressing. Let's nail down the steps after cleaning. Think of this like your 5-step wrap routine. A clean wound isn't safe till it's covered, right?
Exactly. So once it's clean and dry, it flows pretty logically. 1, apply a thin layer of antibiotic ointment if it's appropriate for the wound. Remember, this helps keep it moist too and fight surface bacteria. 2, cover the wound completely with your chosen sterile dressing. Make sure it covers the whole thing. 3, secure it. Use medical tape, maybe an elastic wrap if needed.
Right.
4, just double check how you secured it. You don't want it so tight it cuts off circulation. Give it a little check. And 5, this is the follow-up. Change that dressing regularly. Definitely change it if it gets wet, dirty, or soaked through with drainage.
Got it. Okay, here's where it gets really interesting for me. We're talking about those cuts, those lacerations where the skin is kind of gaping open a bit, maybe too wide for just a regular Band-Aid, but maybe not bad enough for like an ER trip for stitches.
Right.
How do we seal the deal on the, we're talking superficial skin closures. Yeah.
Exactly. This is all about approximating the edges, basically, bringing the skin edges together gently so they can heal nicely, hopefully with less scarring. For field care, we're mainly looking at 2 options. Adhesive strips, Steri-Strips, butterfly closures, or that liquid skin adhesive stuff.
Sutures, staples, leave those to the pros.
Absolutely.
Right.
Medical professionals only for those.
Okay, let's break down the classic. Adhesive strips, Steri-Strips. They look simple, but I bet the way you put them on matters a lot.
It matters hugely. Step
Yeah.
1. You need that perfectly clean, perfectly dry wound surface. Can't stress dry enough.
Okay, try.
Step 2. Cut your strips to the right length if needed. Step 3. This is the crucial move. Apply the very first strip perpendicular, so straight across, right over the center of the
Yeah,
wound.
the middle first.
Got it. That's your anchor. Then, step 4, you place more strips parallel to that first one, working your way along the wound length. But, and this is a really important point people miss, you must leave small gaps between the strips.
Oh, not seal it up tight. Why?
Exactly. Don't seal it like an envelope. Those gaps are critical. They allow for drainage. If you seal it completely, you trap moisture, maybe bacteria, underneath.
Right.
You could turn a simple cut into an infected mess. You need to let it breathe and drain a bit.
Wow, okay, that's a massive tip. Leave space between the strips. Okay, now what about that liquid skin adhesive? That feels like the space age option you see in some fancy first aid kits.
It is pretty neat, but it demands precision. Again, step 1, clean and thoroughly dry. Step 2, this is unique to the liquid.
Yeah.
You have to physically gently hold the wound edges together with your fingers or sterile forceps.
Okay, gotta hold it closed.
Yes. Then, step 3, apply a thin, even layer of the adhesive over the top of the closed wound like you're painting it on. Step 4, keep holding those edges together while it dries. Usually pretty quick, maybe 30 seconds, maybe up to a minute. Read the instructions.
Don't let go too soon.
Don't let go too soon. And then step 5, often recommended to apply a second thin layer just for extra strength once the first is dry. Think of it like a medical-grade superglue. It's great for straight, clean cuts that aren't under a lot of tension.
Okay, makes sense. Right.
Yeah, okay, hold on. Okay. Okay. Cool.
We've handled the scrapes and the smaller cuts. Now we need to shift gears a bit, talk about two situations that can really escalate things fast. Stop the game completely. I'm thinking like a really persistent nosebleed, and then the really scary one, catastrophic bleeding.
Yeah, definite shift in urgency here.
So, scenario 1, the runaway river. That nosebleed that just won't quit, maybe after someone takes an elbow to the face in basketball. What's the strategy if we need to use nose plugs or packing?
Okay, so nose plugs, sometimes called nasal tampons, they're designed to be inserted to apply direct pressure right inside the nostril at the source. If you have to use one, and ideally you're using a commercial one made for this, or sterile gauze packed carefully. The first step is lubrication.
Lubrication.
Yes, always use a water-based lubricant or gel on the plug or gauze first. This is really important because it stops it from sticking to the inside of the nose when it's time to take it out. Prevents rebleeding. Then, for insertion, you gently fold it if necessary and carefully slide the lubricated plug straight back into the bleeding nostril. If you're dealing with a kid or someone with smaller nostrils, you might need to trim the plug in half first. And here's the time constraint. You leave it in place, maybe applying gentle pressure on the outside of the nose too, but for no longer than about 24 to 72 hours max. And crucially, if the bleeding doesn't stop fairly quickly after you put it in properly, or if it restarts heavily later, you need professional medical help right away. Don't just leave it in indefinitely.
Got it. Lube it, insert carefully, time limit, and get help if it's not working. Okay. Now, scenario 2. Catastrophic bleeding. This is the big one. This is when just holding pressure on the outside isn't working. Maybe the wound's too big, too deep. Maybe an artery's involved. This is life or death time.
Absolutely. This is where immediate, decisive action is critical. If direct pressure isn't controlling severe bleeding, you have two main advanced options, depending on where the wound is: packing or a tourniquet. So if the bleeding is gushing from a deep wound, maybe in a place where a tourniquet won't work, like the groin or the armpit or maybe even the neck, and just pressing on the surface isn't enough, your move is packing.
Packing. You mean stuffing gauze into the wound.
Exactly that. You take sterile gauze, ideally rolled gauze, and you firmly, tightly pack it directly into the wound cavity, filling the space. You're trying to apply pressure deep inside, right under the bleeding vessel. Keep packing it in until you can't fit anymore, then maintain strong manual pressure directly over the packing until help arrives. This is for those deep junctional bleeds.
Okay, that's intense. But what if the catastrophic bleeding is on, like an arm or a leg?
That's where the tourniquet comes into play. If you have life-threatening bleeding from a limb, an arm, or a leg, and direct pressure, even elevation, maybe even packing hasn't stopped it, the tourniquet is your absolute last resort.
Last resort. Emphasize that.
Last resort. Because its job is to completely stop blood flow to that limb to save the person's life. But doing that, stopping all blood flow, carries a really high risk of permanent tissue damage, nerve damage, even loss of the limb if it's on too long or applied incorrectly.
Which means if you have to use one, you have to do it perfectly. No room for error. So, what is the tourniquet application playbook? Those 5 non-negotiable steps? We need them.
Okay, step 1. Placement. You put the tourniquet 2 to 3 inches above the wound, so closer to the torso, and critically, never, ever place it directly over a joint like the elbow or knee. It won't compress the artery properly there, and you could damage the joint.
Got it. Above the wound, not on a joint.
Step 2. Strap it tight. Pull the strap extremely tight around the limb and secure it. Get it as tight as you possibly can before you even start tightening the windlass.
Okay, step 3.
Step 3. Twist the windlass. That's the rod or stick mechanism. You twist it until the bright red arterial bleeding stops completely. It will likely be painful for the person, but you have to tighten until the bleeding stops.
Stop the bleed. That's the goal.
That is the only goal. Step 4. Secure the windlass, lock it into place so it cannot possibly unwind on its own, and immediately write it down, yell it out, tell someone note the exact time the tourniquet was applied. Use a marker, write it on the tourniquet strap or on the person's forehead if you have to. Time is everything now.
Time is critical. And step 5?
Step 5. Do not cover the tourniquet. Leave it visible. Emergency responders need to see it immediately, know where it is, and know that time you wrote down. Don't hide it under clothing or a blanket.
Wow. Okay. Placement, strap tight, twist till bleed stops, secure windlass, and note the time, keep it visible. And that time note is so important because of the risk. What's the limit we have to keep in mind?
Yeah, the clock is ticking loudly once it's on. Ideally, you want that person to get to definitive surgical care well before the 2-hour mark. If a tourniquet stays on for 2 hours or more, the risk of permanent damage, losing muscle, nerve function, the limb itself goes up dramatically. They save lives in the moment, but they are absolutely a race against the clock.
Understood. Okay. So we've gone from basic scrapes all the way to life-threatening bleeding. How do we take all this knowledge and turn it into actual readiness? We need that ultimate first aid kit, right? The MVP essentials you should just always have on hand.
Absolutely. And the kit should really reflect the procedures we've just talked about. So you absolutely need plenty of sterile gauze pads and rolls, adhesive bandages, various sizes, good medical tape.
Yep.
Sharp scissors, trauma shears are best, and tweezers. For cutting clothes, removing splinters, whatever.
Yeah.
Antiseptic wipes or solution for cleaning around wounds. Antibiotic ointment. An elastic bandage like an ACE wrap for pressure or securing things. Disposable gloves, lots of them. Protect yourself, protect the injured person. And if you're in a situation where severe bleeding is a possibility and you're trained, a proper commercial tourniquet. Not an improvised one, a real one.
That kit sounds like the difference between panic and actually having a plan.
It really is.
So the big takeaways seem to be proper wound care starts with being clean. Always clean thoroughly. Respect that wounds might need to drain, especially with closures. And understand that a tourniquet is a powerful, life-saving tool, but it has strict rules and serious consequences. And obviously, always get professional help for anything serious or complex.
That really sums it up nicely. Know the difference. Cleaning versus debridement. Understand those superficial closures, but let them drain. Respect the tourniquet, the rules, the time limit, and keep that kit stocked. Because having the supplies is pointless if you don't actually know the steps, the why behind them. And maybe if we connect this back to the bigger picture, really knowing these precise steps, these immediate actions, it isn't just about treating the injury in the moment. It's about enabling a faster, safer return to the game, minimizing those long-term issues. That preparation, that knowledge, it builds resilience. It makes you think, how much time, psychological time, physical recovery time, how much does being truly prepared actually save when things get intense?
It saves everything. That controlling chaos is huge. Stay ready, folks. Stay safe. And aim to be that prepared person on the sidelines or wherever you are. Thanks so much for diving deep with us today.
My pleasure.
We'll catch you next time.